Hello, everyone. It looks like we have a few people still kind of entering the waiting room here, but we'll go ahead and get started. Today we have a wonderful presentation on a National Healthcare Safety Network, NHSN, our favorite topic, it seems like lately, antimicrobial resistance option reporting and analysis. Next slide, please. So as always, we just like to have a reminder about our disclaimer that the presentation may contain information or content supplied by third parties, but this does not mean that we are endorsing it or recommending what is being, what is being oh my goodness sakes, what is being talked about in the presentation. Next slide, please. So as we look through what we have going on around us today, we noticed that, we still have measles outbreaks and cases being reported. So we just like to make sure that you guys are keeping an update on that. And so here's the link to the CDC and the measles cases so you guys can monitor. Next slide, please. We have the new QSO memo that just came out, so we want to make sure that you guys have the link to that and are abreast of that new guidance. Also, April is Parkinson's Awareness Month, so there's a few resources for you to go ahead and click on at your leisure. And then next slide, please. So as we talked about at the beginning here, NHSN vaccination team is providing office hour sessions on March 28th and April 25th. So here are the links you guys can use to register for those. As we look at the influenza vaccination data, deadline is May 15th. So these are good little trainings that you guys may want to hop onto. Okay, next slide, please. And then, as always, we are continuing to take any suggestions for presentations. We'd like to hear your ideas or areas of focus as they come to you. Please let us know. We'd be more than happy to explore the topics and then present on them in the upcoming weeks. And with that, I think we have a polling question. Mary, go ahead and pop that up. All right. Our polling question today, do you have an EBP policy and procedure in place? And that's the emergency, oh my goodness sakes, today has been one of those days, people. But if you guys have one in place, that's a great option. And then looks like we're getting some more responses in here. Just about done. All right. Mary, I think you can end that poll, and it looks like over half of you guys have one in place. So that's great. And share those results. Awesome. Okay, next slide, please, Mary. The weekly influenza snapshot. As you can see here, we're kind of on the downhill slide. So that's good to see as of, influenza season week 11, which is ending March 16th. We are seeing that all states are on the decline for their influenza outbreaks. Next slide, please. And then as always, here's our influenza snapshot, or excuse me, COVID-19 snapshot. And as the influenza one, we are seeing a decline in the COVID-19 cases as well. So if you guys want to hop onto the covidcdc.gov site, you guys can see where your state and your counties are at. As we are seeing, there's still some moderate to substantial cases out there. So we just want to give you guys an idea as to what this looks like today. All right, and then next slide, please, Mary. So I'm happy to introduce Virgie Fields. She is a public health analysis with Plantana Consulting Group, a contractor for the National Healthcare Safety Network, NHSN, within the surveillance branch of the Division of Healthcare Quality Promotion at the CDC. In this role, she is a subject matter expert for the NHSN antimicrobial use and resistance module, working with facilities, healthcare systems, and software vendors to support the reporting of antimicrobial use and resistance data into NHSN. Virgie earned her Master's of Science in Epidemiology from Harvard University and Bachelor of Science in Biomedical Engineering from Virginia Commonwealth University. She is also a certified public health and infection control. She's also certified in it. So we are extremely thankful for Virgie to be here today. She's obviously got a wealth of knowledge for us. So I tried to go as fast as possible through those slides so she can have the rest of the time. And then as always, if you guys have questions, please don't hesitate to pop them into chat. All right, with that, thank you, Virgie, and we'll give you the slide deck.
Thank you so much. Thanks everyone for having me today. As mentioned, my name is Virgie Fields, and I'm a public health analyst supporting the NHSN antimicrobial use and resistance module. I'll be giving a high-level overview of the NHSN AR option reporting and analysis, and then I'll highlight a couple of our AR option reports that are of interest. And just to give you a fair warning, this is not how my voice sounds. I am recovering from a cold, but so please bear with me today. Next slide, please. So I'll spend a little bit of time discussing where AR option data come from. Next slide, please. Let's take a quick look at how AR data are extracted and handled by the NHSN application. First, commercial software vendors or homegrown software systems extract numerator data from your facility's electronic medication administration record, or EMAR, or barcoding medication administration, or BCMA system for the AU option, and your laboratory information system, or LIS, or electronic health record, EHR system for the AR option. The system extracts denominator data for both the AU and AR options from your facility's admission, discharge, and transfer, or ADT system. Then the system selects the correct records and aggregates the data according to the AUR module protocol. No manual data collection or entry into NHSN is allowed for the AUR module. And then finally, the system packages the data in the correct format using the implementation guide, and the data are submitted to NHSN. Next slide, please. So each vendor system looks different. Some utilize direct submission with NHSN, where the AUR data are submitted to NHSN with the click of a few buttons. Some have facilities download zip files that contain the AUR data to upload via manual submission. And I've included links here to vendors that have passed our AU and AR synthetic dataset, or SDS validation. Next slide, please. So AR option event data is what we consider the numerator data, are isolate level susceptibility results for specific organisms. For an isolate to qualify for reporting to the AR option, it must be collected in an eligible location or unit, collected from one of 4 specimen types. So we accept blood, cerebral spinal fluid, or CSF, urine, and lower respiratory. It must have identified an eligible organism, and antimicrobial susceptibility testing must have been completed for at least one drug. The isolate qualifies for submission regardless of susceptibility results. This means that even isolates that are susceptible to all required antimicrobials, they are still eligible to be reported to the AR option. Next slide, please. For AR option summary data, which is what we consider denominator data, facilities report patient days, which is the number of patients present in the facility at the same time on each day of the month, also called the daily census. And this is reported for faculty in or facility facility-wide inpatient locations only. And this is the same definition used for the NHSN healthcare-associated infection or HAI reporting. Facilities also report admissions, which is the number of patients admitted to an inpatient location in the facility. This is reported for faculty only, and is the same definition used for the AU option, but differs from the HAI reporting. Facilities also report encounters, which is a visit to an eligible outpatient location for outpatient locations only. Next slide, please. So how are AR option data manually uploaded? Next slide, please. First, you want to add the AR option to your monthly reporting plan. For every month you plan to submit AR data. Facilities cannot upload AR data off plan. In the monthly reporting plan, you want to check the AR box only for facility-wide inpatient or fac-wide in, ED or emergency department, pediatric ED, and or 24-hour observation area. Checking the AR box for fac-wide in allows you to submit AR option data for any mapped inpatient location. You do not want to check the AR box for individual inpatient locations. Next slide. So the AU option portion is slightly different from the AR option portion of the monthly reporting plan. As with the AR option, you will need to add the AU option to your monthly reporting plan for every month you plan to submit AU data. You need to check the AU box for each individual location that you plan to upload data for, including fac-wide in, each of the individual inpatient locations, the ED, pediatric ED, and or 24-hour observation area. To include fac-wide in the monthly reporting plan for the AU option, you must include at least one individual non-fac-wide in location, for example, a medical ward or the emergency department. Next slide, please. Here's an example of including the AUR module in a monthly reporting plan for your reference. Next slide. So after generating the zip file with your AUR data from your vendor software system, in NHSN, you want to select Import Export on the left navigation menu. And depending on your user rights, you will either see AU and AR summary data or events summary data procedure denominators. Both of those options allow you to upload antimicrobial use or AU summary, antimicrobial resistance or AR summary, and AR event data into NHSN. If you do not see either of those options, a user with administrative rights must change their user rights and then can follow our NHSN AR users rights document linked on this slide. Next, you'll choose the zip file that contains your AR data, and then you'll click the Submit button. Next slide, please. So here's a screenshot of all those steps I just mentioned of the import export data screen to upload your AR data. Next slide. So after you upload your AR data, what AR option analysis reports are available to you in NHSN? Next slide. First, and we always say this, remember to generate data sets. Generating data sets is the first step to performing analysis in NHSN. Newly uploaded data do not appear in the NHSN analysis outputs until you generate new data sets. I have linked a quick reference guide on how to generate data sets on this slide. Next slide, please. So we have been slowly adding new AR reports over time. You can find all the AR option reports under the antimicrobial use and resistance module folder and the antimicrobial resistance data folder. We have the SRIR and the PSIR reports, which I'll highlight in a second. We have a line list, bar chart, and the facility-wide antibiogram to review AR events, as well as a line list, frequency table, and rate table to review antimicrobial resistant organisms, or what we call phenotypes. And then a line list is available to review AR summary or denominated data. And then we have 6 rate tables for the AR incidence and prevalence reports. Next slide, please. So I just wanted to highlight the SRIR and the PSIR reports. There was an hour-long session that I did during last week's NHSN annual training. So those slides I am recording will be available on the website soon. Next slide, please. CDC developed 2 new NHSN AR option benchmark metrics using 2019 as the baseline year. The reports became available to NHSN facility and group users in 2023. The 2 metrics are the SRIR, which is the standardized resistant infection ratio, and the PSIR, which is the pathogen-specific standardized infection ratio. Both of these are observed predicted ratios, like the AU options, standardized antimicrobial administration ratios, with the SARS, the standardized infection ratios, the SIRs, and the standardized utilization ratios, or the SURs. Next slide, please. So hospitals can compare their rates of hospital onset infections of specific AR phenotypes or pathogens to a national benchmark. For the SRIR, we are looking at infections of specific AR phenotypes, such as MRSA. And for the PSIR, we are looking at infections of specific pathogens, such as Staphylococcus aureus. Health departments and systems can use the SRIR and the PSIR to better understand these issues across and between facilities in their jurisdiction or health system. Next slide, please. To calculate the SRIR, we divide the number of observed resistant infections by the number of predicted resistant infections. To calculate the PSIR, we divide the number of observed infections by the number of predicted infections. Next slide. Observed resistant infections are the number of resistant hospital onset isolates reported to NHSN for the following 7 phenotypes. Predicted resistant infections are the number of resistant hospital onset isolates for a particular phenotype predicted for a hospital based on negative binomial regression modeling applied to nationally aggregated 2019 AR data. And so I've included a link on this slide for the phenotype definitions that could be found in the AUR module protocol in Appendix I. Next slide, please.
Virgie, real quick, we had a question come through. Is this for both hospitals and long-term care facilities?
So the AUR module currently only accepts data from hospitals as well as inpatient rehab, inpatient psych, LTACs, in addition to acute care and critical access hospitals. We currently do not accept data from long-term care facilities such as skilled nursing facilities yet.
Okay, thank you.
For the PSIR, observed infections are the number of hospital onset isolates reported to NHSN for the following 4 eligible pathogens or pathogen groups. And you can see those on the slide. Predicted infections are the number of hospital onset isolates for a particular pathogen or pathogen group predicted for a hospital based on negative binomial regression modeling applied to nationally aggregated 2019 AR option data. Next slide, please. So facility-wide SRIRs and PSIRs can be calculated for 3 specimen sources, and that's blood, urine, and lower respiratory tract. The default SRIR report has 21 tables, and the default PSIR report has 12 tables. These reports default to facility quarter level and are also available at the half-year, year, and cumulative levels. These reports are not available by month. And facilities that report eligible AR option data can generate SRIRs and PSIRs for January 2019 forward. Next slide, please. So where can you find these reports in NHSN? As mentioned before, all of the AR option reports are found in the antimicrobial use and resistance module folder underneath the antimicrobial resistance data folder. And then the SRR and the PSI reports are the first two reports listed in the AR data folder. Next slide, please. Here's an example of the SRR report output. And for the interest of time, I'm not going to stay on this. So next slide, please. And then this is an example of the PSI report output for your reference. Next slide, please. I will briefly highlight our facility-wide antibiogram, percent susceptible and percent tested report. Next slide. So the AR facility-wide antibiogram and percent tested report provides two tables based on AR events reported in NHSN. The report displays the calculated percent susceptible or percent S and percent tested or percent T for each organism antimicrobial combination reported from all locations, and that's inpatient and outpatient. The report defaults to show data by quarter, but can display by additional time groupings. The antibiogram is available to both facilities and groups, and there are filters available to allow users to customize the report output. Next slide, please. NHSN calculates percent S or percent susceptible for each organism antimicrobial pairing using the formula number of isolates tested susceptible divided by the number of isolates tested. And percent S is only calculated if at least 30 isolates are tested for the specific antimicrobial. Next slide, please. NHSN calculates percent T or percent tested for each organism antimicrobial pairing using the following formula, which is the number of isolates with the susceptibility result divided by the total number of isolates. And all of these percentages are times by 100. Susceptibility results include S, which is susceptible, SDD, which is susceptible dose dependent, I, which is intermediate, R, resistant, or NS, which is not susceptible, and percent tested only calculated if at least one isolate is tested for the specific antimicrobial. Next slide, please. The default settings for the AR facility-wide antibiogram produce a report by quarter, but users can make modifications to display the data by month, half-year, or cumulative time periods. Additionally, NHSN includes all specimen types, and that's blood, CSF, urine, and lower respiratory. The patient population includes neonatal, pediatric, and adult, and the location, as well as all isolates regardless of organism categories. So that's gram-negative, gram-positive, and fungal. The onset is hospital and community onset. And so all of these are shown by default, but users can make modifications to further filter the output. Next slide, please. So NHSN sorts pathogens by organism category, gram-negative, gram-positive, and fungal. And then drugs are sorted into drug classes organized alphabetically. Cells that are shaded in gray represent non-valid pathogen or drug combinations, which means that susceptibility tests for those drugs are not reported for those pathogens. And then users can refer to the AR module protocol for all valid pathogen or drug combinations. Next slide, please. So you can find the AR facility-wide antibiogram in the AR data folder, and you want to click facility-wide antibiogram, percent susceptible, and percent tested report. Next slide. So this is an example of the antibiogram, the percent susceptible table. Interest of time, I'm going to skip this. Next slide, please. And this is what the percent tested table in the same report looks like. This would be the second table. Next slide, please. So the health department mentioned receiving questions from facilities regarding the exclusions for the AUR measure for the CMS or the Centers for Medicare and Medicaid Services promoting interoperability program. So I have a few slides that discuss the exclusions. Next slide. Currently, any eligible hospital or critical access hospital meeting one or more of the following criteria may be excluded from the AR measure if the eligible hospital or critical access hospital does not have any patients in any patient care location for which data are collected by NHSN during the EHR reporting period, or does not have electronic medication administration records, EMR, barcoding medication administration, BCMA records, or an electronic admission discharge transfer, ADT system during the EHR reporting period, or does not have an electronic laboratory information system, or LIS, or electronic ADT system during the EHR reporting period. Next slide, please. So NHSN can provide guidance, but ultimately CMS decides whether a specific scenario meets exclusion criteria. Exclusions are reported in the CMS Hospital Quality Reporting, or HQR system, which I've linked here on the slide, as well as the user guide. Exclusions are submitted during the HQR open period, which is from January 1st to the last day in February. Hospitals claiming exclusion on AU or AR would claim an exclusion on the AUR measure as a whole. NHSN encourages facilities to report the data you have available. For example, if you claim an exclusion for AR, we encourage you to still submit AU data if available. Next slide, please. So we know that many hospitals send their isolates to an external laboratory for identification or antimicrobial susceptibility testing, but that does not automatically make a hospital eligible for an exclusion. It only matters how the data come back to the facility. So if the eligible hospital does not have access to discrete results for all eligible organisms as outlined in the AUR module protocol, the hospital may claim an exclusion to the AUR measure. If the data come back to the facility in a format that is not interoperable, then they would claim the lack of LIS exclusion because it's the closest exclusion to their scenario. Next slide, please. For example, if Canada isolates are sent out for identification and or antimicrobial susceptibility testing and returned to the facility via PDF or fax, then the facility does not have interoperable data and should claim the exclusion. But if the Canada isolates cannot be speciated, then those isolates are not eligible for AR option reporting, and facilities should not claim the PI program exclusion. Or if Canada isolates are speciated but do not have antimicrobial susceptibility testing performed, then those isolates are not eligible for AR option reporting. For example, the facility isolates Canada albicans from a urine specimen but does not perform susceptibility testing on that isolate. The isolate is not eligible for reporting to the AR option, but the facility should not claim a PI program exclusion for that reason. Next slide, please. So these last few slides include some resources for helping you run and interpret the analysis reports. Next slide, please. Here are some general analysis resources for how to generate data sets, how to modify a report, and how to export data from NHSN. Next slide, please. And here are some direct links to specific resources for the AR module, including our protocol, our quick reference guides, our training page that includes recordings, and quick learns, as well as our FAQs. And then the last few bullets are for the CMS PI program. Next slide, please. For any questions, we ask that you contact the NHSN help desk via ServiceNow, which you can access via SAMS, or you can email us at the nhsn@cdc.gov and just include AUR in the subject, and we'll answer your questions there. And that's it for me today. Thank you.
All right, thanks, Fergie, so much for coming on, and you are obviously a wealth of knowledge, so we appreciate you condensing that knowledge base into a few slides and to entertain us for a few like almost 30 minutes. So I appreciate that, and it's very knowledge based, and I appreciate hearing all the fun new reporting aspects that are coming about. Does anybody have any questions? We have a few minutes left here. Anybody has anything? If not, we do have, again, some resources available on our website. Again, to tune into those NHSN training modules coming up in your future. And then also, we do have enhanced barrier precautions. I guess that MOU that came out, we have some tools and resources on our website. So feel free to look on there under infection prevention. And as always, we'd like to say thank you guys for joining us today and for tuning in, and to our presenter, Virgie, for taking the time to help us out. And next week we will be presenting again. So tune in next Wednesday, same time, same place. Thanks, guys. Have a great day.